As President and CEO of Fraser Health, I am honored to welcome Minister Dix and Dr. Bonnie Henry back to our region and to thank them for their ongoing leadership throughout this very challenging time with COVID-19 pandemic. We are conducting our business today on the unceded and traditional shared territories of Katzie, Semiahmoo, Kwantlen, Coquitlam, and Tsawwassen First Nations. I refer to the 40,000 people that work and volunteer in our region in Fraser Health as Fraser Health family. I'd like to share a few quotes from members of our Fraser Health critical care team. The first one is one of the members that said, "The majority of the time we are the last people COVID patients have spent time with and have shared their fears and hopes with. And then we carry the burden of their death on our shoulders." The creativity and adaptability of staff have used to provide care and supports one another has been really inspiring, but it's not sustainable long term. Fraser Health region has borne a disproportionate share of COVID-19 cases in the province. This is in large part because majority of essential workers, workplaces, industries are located in our region. We're also the most populous and densely populated region in the province. As you are likely aware, Fraser Health Hospitals has had the highest number of COVID-19 patients in our acute that are both sicker and younger during this wave. We're doing everything possible to ensure that every patient and family is getting great care. I think Minister mentioned earlier that it's been about 500 days, so more than a year into the pandemic. And Fraser Health family continues to demonstrate tremendous leadership and dedication to safeguard this community by having a robust public health response, including case contact management, expanded testing, and also protecting our vulnerable populations. I also, as the CEO and President of Fraser Health, need to ensure that we're taking care of our caregivers who are experiencing mental, physical, and emotional toll as a result of their extraordinary efforts. Right now, protecting our caregivers means registering right away. Every adult 18 years and over are eligible, so please take your time right now to take the 3 easy steps to get registered, to book your appointment, and to get immunized as soon as possible. Fraser Health has the capacity to deliver more than 20,000 vaccines a day. We have made great strides in protecting our frontline workers and also in areas of concern where we have had additional transmission or high-risk communities. We have invited all of the police, fire, teachers, bylaw, daycare, and grocery store workers as well, and that has expanded regionally. I'd like to recognize our local community and government partners as well, our mayors, communities, MLAs, industry networks and organizations, and they have been tremendously helpful throughout the pandemic and continue to support us throughout our immunization efforts. While it remains critical that we continue to follow public health measures, I'd like to remind everyone again for us to put the pandemic behind us. Let's go through the 3 steps, 1 being registering, 2 booking, and 3rd getting your shot as soon as you're eligible. So with that, it's my pleasure and privilege to invite Dr. Bonnie Henry, our Provincial Health Officer, to the podium. Thank you.
Thank you very much and good afternoon. So this is our COVID-19 update for the province of BC, and we're very happy to be here in the Fraser Health region today. Today we report 684 new cases of COVID-19 have been diagnosed in the province in the past 24 hours, one of which was an epidemiologically linked case. So that brings our total in the province to 133,619 people diagnosed with COVID-19. Of those, 153 people are in the Vancouver Coastal Health Region, 445 are here in the Fraser Health Region, 17 people live on the Vancouver Island Health Region, 52 people live in the Interior Health Region, and 27 in the Northern Health Region. That leaves us with 6,802 active cases across British Columbia, of whom 457 people are in hospital now, 154 of them in critical care or ICU. And 125,025 people have now recovered from COVID-19. We have no new outbreaks to report today, leaving us with 4 active outbreaks in long-term care assisted living or independent living and 3 in our acute care facilities. We have 1 additional death to report in the last few days, bringing our total to 1,595 people who have died from COVID-19 in British Columbia. And as always, our condolences go out to the families, to the caregivers, and to the communities. We mourn the loss of each and every individual along with you. We have been reaching another exciting milestone, though, in our immunization program here in BC. So sometime today, the 2 millionth dose will have been given to people in British Columbia. This is very good news. So far, as of early this morning, we've had 1,995,496 doses of all 3 of our COVID-19 vaccines administered in British Columbia. And of those, 95,868 were in people who received a second dose. Our immunizations are going up quickly, and the ages for those who are eligible for their vaccine is coming down. As of today, anyone 49 years of age and older can book their vaccine. And as well, we're continuing, as Dr. Lee mentioned, with our worker program and our outbreak response, using immunization as one of the tools. We will continue to share the latest age eligibility in our statements, and you can also go to Immunize BC, the BC CDC, or Government of BC websites to find the latest information and see where you will stand. But what I can tell you is with the vaccines that we have been receiving this week, we're now in a place where we can move very quickly down these age groups. And so the important thing is for you to be registered. So as soon as your age group comes up in eligibility, you'll be able to book your appointment. Yesterday, Health Canada announced that the approval of the Pfizer-BioNTech vaccine, the one that we have the most of here in the province, is now approved for use in young people down to the age of 12. And we are working with our BC Immunization Committee and our public health team to determine exactly how then we can best immunize young people. And when the youth program is finalized, we will be providing all of the details to people. I would like also to share that we have had our first case of vaccine-induced immune thrombotic thrombocytopenia, or VIT, that we have seen around the world and across the country. And this was following a receipt of an AstraZeneca COVID-19 vaccination. And the person is a woman in their 40s. She is stable and currently receiving treatment in a hospital in Vancouver Coastal Health. This is something that we know is rare, but is associated with the AstraZeneca vaccines that we have been receiving here in Canada. The recent update of this safety signal with the information that we have from around the world is that the likelihood of this happening is about 1 in 100,000 doses. There is, however, a test that can help determine if you do have this syndrome, and there is treatment. But of course, recognizing symptoms and getting treatment early is important. And I know there are a lot of people who've received this vaccine. It's an important part of our program, particularly over the last few months as we've been dealing with this new surge in cases in our third wave. So while rare, the potential for this blood clot to develop is between the days, generally day 4 and day 28, around that period of time after you've received your vaccine. So if you have had a vaccine, any vaccine, and are feeling unwell, you can call 811, you can talk to your healthcare provider, particularly if you have symptoms that are concerning, such as a persistent severe headache, shortness of breath, chest pain or severe abdominal pain, and swelling or redness in a limb. These are things that should provoke you to get treatment and assessment right away. We can, however, be confident for those who have received the AstraZeneca vaccine here in BC that this is an excellent vaccine. It is safe and it is effective, and we only need look at places like the UK to see how effective it is in preventing transmission, making sure that you are protected yourself, but also protecting your family and those that you are closest to. And it is, as I mentioned, an important part of our program here in British Columbia, particularly at the time when we were managing this surge in our third wave. I recognize it can be alarming to hear of this blood clot, and if you are somebody who's received this vaccine, you need to know that it is rare and it is treatable, and you can be confident that you have received a safe and effective vaccine. I also am confident that all of our vaccines that we are using in our program here in BC and in Canada are being monitored carefully, and the safety signal that we saw and what we've seen now with this person being our first case here in BC tells us that our safety monitoring system is working, and we will continue to provide you information as it becomes available. My family and friends have received the AstraZeneca vaccine along with millions of others around the world. And I am confident that they have done the right thing to protect themselves and our community. Also want to remind people that our Speak survey continues and will be open for the next week or so. And so far, over 192,000 people in BC have completed it, but we want to get that number up, particularly if you're in the interior, in the north. We want to hear from you about how the pandemic and how the measures that have been put in place and the immunization program have affected you. And please help the seniors and elders in your life complete the survey and share their stories as well. So the Speak survey is available on the BC CDC website at bccdc.ca COVID-19 survey. It is incredibly encouraging to see our immunizations going up and our rates of transmission ever so slowly bending down. It's also so important that we've started to see the impact of the measures we have been taking together in BC, meaning that hospitalizations and ICU admissions are also decreasing. This is a huge relief to many of us, to our colleagues who are working so diligently every day in the ICUs here. I had the privilege of visiting the Surrey Memorial Hospital, and the team there, I know, is doing everything they can to treat people. And the fact that we're no longer seeing that surge of admissions is a tremendous relief for them too. And it shows that what we are doing here in BC right now is working. It is working to prevent transmission and to save lives. By continuing to follow all of our safety basics and for all of us to get our vaccine as soon as we are eligible, we will be one step closer to that point where COVID will no longer be disrupting our lives the way it has for this past year. When it is your turn to get your vaccine, take a photo and share it with your friends and family. Encourage them to get their shot too. By doing this, you're showing them that you have done your part to help protect them as well. And today, 2 billion doses will be in people's arms here in BC. We need to keep this momentum going. We are closer every day, and we'll get there by continuing to follow the public health guidance that we have in place, by making sure we're staying small, by making sure we are not traveling for vacation or recreation, by wearing our masks and doing all of those things that we have been doing, and by getting vaccinated when our turn comes up, as it will for everybody in the coming weeks. And as well, we need to remember to continue to get us through this together by being kind and being calm and staying safe. Thank you.
Thank you very much, Dr. Henry. Thank you very much, Dr. Lee. I want to start by acknowledging the person that passed away and related to COVID-19 in the last 24 hours in BC. The one death reported was in the Interior Health Authority, and everybody involved. But I think in this time of pandemic, these losses are felt profoundly. They're felt profoundly in both of our public health emergencies. And so I wanted to pass, on behalf of the Premier of the government, I think everyone in BC, my condolences to the family, the friends, and the caregivers of the person who passed away, and all those who've lost loved ones during the COVID-19 pandemic. In the last, we're happy to be in Surrey. Obviously, the teams at Fraser Health, not far from where I'm speaking, teams of contact tracers who are doing a remarkable job, not just identifying cases of COVID-19 and providing, but also providing support to people who test positive for COVID-19 and limiting transmission. The work they have been doing now for months, really onto a year, it has been heroic. And I want to pay tribute to everyone in Fraser Health who are involved in critical care, where our outcomes, though challenging because of the numbers of people involved, are not just the best, some of the best outcomes in Canada, but in the world in critical care, reflecting the quality of those teams. Dr. Lee and her team, all the people involved in the vaccination program and primary care in communities, all of the people involved in supporting all of the other people with all of the other mental health, addictions, physical health challenges that Fraser Health deals with every day. It's important to be here to recognize their work and to recognize what people are doing in this community of Surrey, in Fraser Health and across the province. Today I can tell you that 2,179,000 people, 402 people have registered. On Monday morning that number was 2,001,823 people. So 178,000 people have registered over the last 3 days, reflecting a lot of the work done, not just by Fraser Health, but by people in the media, by the community here in Fraser Health and in other health authorities, reaching out to people and encouraging them to register. And I want to say to people, this is the time to register, register, register. And when your moment comes to book your appointment for a COVID-19 vaccine yesterday, 52,266 doses were delivered in BC. That's a new record, and we will be setting more records in the coming weeks in terms of vaccination. So this is the time for everybody. I mean everybody, especially in communities that have higher rates of transmission, but everywhere in BC, everyone to register for their COVID-19 vaccine. I would note that the age for booking is going to be dropping precipitously over the next week, so registering puts you in position to get your vaccine first. And if I can repeat it one more time, register. As Dr. Henry has said, 1,995,496 doses have been delivered. That's 1,899,628 first doses, are about 44% of those eligible, because the number of people eligible is going to likely change soon, so that number will change and the number we use will change. But of the people currently eligible, and that is well ahead of where we thought we would be at this point. But this is the time, with doses arriving, that we need you, everyone, to do their part and register, because every time you get vaccinated, every time somebody gets vaccinated, everybody in BC is safer. I talked about the people in acute care earlier, and I just wanted to bring a regular update on the surgical renewal commitment and where we stand. As you know, there are 457 people hospitalized across BC. That number in the Fraser Health Authority is 277. And while that number is slightly down from the 511 we saw a number of days ago, it's nonetheless very significantly too high. 154 people in critical care, twice as many as at the height of the COVID-19 first wave in April of 2020. And the work being done there is extraordinary, but we need fewer people in hospital. And that has an effect on all of the other care that we provide in hospital, as well as our healthcare workers and, of course, the patients in hospital as well. For patients in hospital and their families, this is an incredibly challenging time. We have excellent healthcare staff in BC, and their commitment to care has been seen throughout the pandemic. To support our healthcare staff in continuing to deliver that care, several health authorities that have been most affected by the pandemic, principally Fraser Health and Vancouver Coastal Health, have reduced surgeries in the last couple of weeks. This means a number of people who are waiting for non-urgent scheduled surgeries have had their surgery postponed. We know that every one of those surgeries is important, and we are tracking every one of them. A year ago, when we made our surgical renewal commitment to patients, we said each of those thousands of patients would get their surgery. And we reported in March that 95% of them had received their surgery. To be clear, our surgical renewal commitment is also to each one of our patients impacted by recent postponements. As soon as the COVID pressure on our hospital is reduced, each of those patients will get their surgery as well. Today, we can report the number of surgeries postponed from April 26th to May 2nd was 421. That's 130 in Fraser Health, 242 in Vancouver Coastal Health, and 49 in Vancouver Island Health. It is important to note that no surgeries were postponed in Interior, Northern Health, or the Provincial Health Services Authority. This means in the 2-week period from April 19th to May 2nd, a total of 819 surgeries have now been postponed. Health authorities continue to provide urgent and emergent surgeries, and where possible, non-urgent surgeries as well. And to that key point, here's the week's surgical update for April 19th to the 25th. Health authorities completed 7,103 surgeries during that week, of which 5,581 were scheduled and 1,522 were unscheduled surgeries. By health authorities, that's 1,991 in Fraser Health, 1,346 in Interior Health, 436 in Northern Health, 1,580 in Vancouver Coastal Health, 1,487 in Vancouver Island Health, and 263 in the Provincial Health Services Authority. Our indicators, many of our indicators, of course, are moving in the right direction. As I said, right now, about 44% of those eligible have had their first shot. We are moving very, very quickly in our vaccination rollout, particularly in communities such as Surrey. Getting vaccinated will not only help to protect ourselves, but will protect our loved ones and our communities. And as important, will reduce the COVID pressures on our hospitals and surgeries. It's essential that we get vaccinated. If you have not yet registered, if I have not mentioned that before, we must register now. When our turn comes, we'll be invited to book, and we should book right away. We can go to the Get Vaccinated BC website, or alternatively call 1-833-838-2323 to take that vital step in making ourselves and our communities safer and reducing the toll that COVID is taking on our hospitals and healthcare staff. It's been a long and tough fight against COVID-19, but continuing to use our COVID skills now and getting our shot as soon as we can will change the course of our pandemic and make the difference that we've all been hoping for. And with that, I want to invite Dr. Henry back to the podium, and we're happy to take your questions.
Thank you. As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Katie DeRosa, Vancouver Sun. Katie, please go ahead.
Just before Katie, I apparently have misspoke again. My apologies. I think I said there were 684 cases. The total number is actually 694 new cases today, so I apologize for that.